Okay, we've been sent another case. This is a case post-ridge augmentation. You can see the ridge augmentation was done with a couple of tacks on the lower right hand side. Quite honestly, well done. The note that was submitted with the case mentions that the tack has come loose, but they will remove the tack at the time of placement. And quite honestly, there's not a lot of review to do here, just a couple of things I think would be a good opportunity to maybe really go over how I would maybe consider finessing this particular case. So obviously this is a digital workflow. We've got the CEREC data well integrated, so we could do OptiGuide, DigiGuide, or two individual CEREC guides or CEREC guide through the lab, which would allow you to mill a guide with two holes in it. Let's evaluate our CEREC plan, and again, pretty well done. A couple of minor issues that I would probably want to correct here is in looking at our tissue level. I probably think this is a more where I'd want my tissue to be drawn. So right here you can see that we are here in the yellow, you can see these areas a bit longer than we'd like. And again, this is just a matter of looking a little bit closer when we're doing it, so that way we can get that much better each time. Okay. Other than that, it looks very nice, and looking at it down the line and occlusally, we look pretty good. I would probably say that maybe right here, that contour right there is a little bit bulbous. I would say maybe we'd want it to be a little bit more squared off back here, and maybe just a little bit more squared off right here to allow for a more hygienic contour, to maybe not get as much food trapped there or something along that line. But here I'm just being a little bit nitpicky. More of the finesse I would do in this particular case is more along with the implant angulation here. Now when I take a look at this down the line, what I know is that these teeth tip in a little bit, but our implants are going straight up and down and almost really coming out of the buccal cusp right here and right here. So I would probably take a look at this, especially on the molar. You can see here it becomes more evident our tooth is kind of going like that, but our implant is going like that. So now listen, we can't sit here and go like this with our implant, okay? We can't go that dramatic, but we can make an attempt to give this implant a little bit of a lingual tip like so. And the reason we would maybe consider doing something like that is, so let's take a peek at that now here down the line, and we can see that our implant is now leaning. Let's see if we can compare that to plan 1, the original plan. So right here you can see how tooth number 30 is more to the buccal side. And then if we go to plan 2, we can see how that implant is leaning in, like it follows the arch form a little bit, so our axial forces will be a little bit better there. So something like that. And again, we have enough room here to build out emergence. Based on our original earlier conversation, that emergence is probably a little bit, wouldn't be quite that down right there. So ultimately these are just some minor things I would take a look at, and certainly here we've got plenty of space to be able to do that like so. So again, if we take a look at this and compare it, so now when I look that straight down right here, I can see that I'm going straight down the central groove and I'm leaning in a little bit. Compare that to our original plan, and now these implants look like they're leaning out. Just a minor issue here. Not again, what has been planned will not. It's not that it won't work. It's just that I would want to take another look at this and another way of doing it. So, thank you very much for submitting the case.